Hi, this video is the hair transplant surgery, the artistry behind it. This client has brown blonde hair, more brown, and basically he's had a class 4 hair loss pattern heading toward 5, and although he has hair here but it's very thin, so I just blow the hairline, rebuild the hairline, and bring his temple. Again, if you follow my work, it's very consistent, and we're going to be attempting at least 4,500 or 5,000 graft on him because the front will eat up at least 3,500, and then the back, whatever we'll have, we just scatter and cover the back, and if I can get more, we'll cover that too. But you know, the surgical skill will give you the density, but there's a whole artistry behind hair transplant, and you want to be able to focus on the artistry of the hairline, because you want to be able to have the result is so natural. It's not just dense, but if it's dense but it looks not natural, then it draws too much attention. You don't want some people hairline so high where it draw attention, and you can see some or you can do it so low it draw attention. So the key word is to make it very proportional to your overall face, and that's where the artistry came in. It's a third and a third. From the mid eyebrow to the hairline for Asian and black is around 6.5 to 7 centimeter. For Caucasian is around 7.5 to 8.5 centimeter, although some will have a little bit lower than that. And then after, or we look at landmark. Sometime the highest crease after you frown, then you put a finger breadth, and then somewhere up there around that area. And once we got the hairline down, again, the more narrow the face, the more arched back the hairline is, and then the more round the face, the more flat the hairline is. And he has quite a bit of narrow face. And then we're bringing his temple on both sides. If you can turn here, you can see we're broadening his temple. And the reason is this: we want to make sure it's proportional vertically and horizontally as well. And because if I lower his hairline, wouldn't bring his temple. Depending on some people, pretty bad. His is not as bad, but some people it is so far back that we don't bring it in. You're gonna have a low hairline with a wide forehead, and that's not natural. The key word is to make it so natural that it take the attention away from the hairline, and you don't want to draw attention to the hairline. And then of course there's a zigzag involved, and it depends on the type. There's 4 types. There's a tight hairline, where that's most celebrity used, and then there's the soft hairline, where people have a personality more conservative, and you don't want to draw attention, but the drawback is less dense than the medium or medium tight or tight hairline. Then you push the envelope for more density, but yet without drawing attention. That's where medium hairline zigzag come in play. And then it's called medium tight, which is you push the envelope a little bit more for density, and again, you still don't want to draw too much attention. So for hair with fine thin hair, you tend to do medium tight hairline. For very thick hair, you can get away with medium hairline and still give you the density. And then of course we transplant the hair, the 35-45 in the front, follow, and then go back when you move toward the back, and changes when you go sideways. And not just a precise angle, but selection of hair grafts is important. We transplant rows and rows single hair graft in the front, followed by root, go 2 hair, 3 hair, and 4 hair in the back for bulk and volume. So this is the before surgery, and then hopefully he will allow me to do the filming 6 months and a year later, and you can see a big transformation for his hair and his the type of hair who he'll come in. And so I'm excited for him because it's going to be a great transformation for him. With a full set of hair, as I mentioned many times, it's going to bring back his youth and his look, his handsome look. Thank you.